facing too much mood swings. Like one time in the morning I'm happy, in the afternoon I'm sad, and then again in the evening I feel like I have to cry. I've been facing a lot of issue with my periods, acne and weight gain, especially around my belly area. बहुत stress हो रहा है मुझे इसका.
Have you ever been diagnosed with PCOD or PCOS?
Aren't they the same thing?
They are not the same thing.
मेरे साथ क्या हुआ है ये कैसे figure out करेंगे?
Medications are not very important.
Is there something do I have to cut from my diet completely for better hormonal function?
Yes.
Is it common that people actually think that stress is the major reason for being in a PCOD condition?
So the main reasons for PCOD and PCOS is
So फिलहाल तो I'm not planning for kids, but in future I may plan for kids. So what are the precautions or tips you would give me? Hi doctor, how are you?
Hi, I'm good. How are you?
I'm good. I've been facing a lot of issue with my periods, acne and weight gain, especially around my belly area. And you know my hair are also thinning and बहुत stress हो रहा है मुझे इसका.
Right. Since how long have you been facing this? How many months?
I'm facing this since my back teens.
It's happening from a very long time.
Yes, very long.
Okay. And along with this, do you feel tired at a specific time of the day, or it's throughout the day or after meals? Anything specific?
I feel tired throughout the day. Like there's no such specific time, but I feel once I wake up, I feel tired.
Okay.
Yes.
And how are your food cravings? Do you crave a lot of food? Do you feel that I want to eat some sweets or spicy food, anything specific?
Yes, I do. Especially after having my lunch and dinner, I crave for something sweet.
Okay. So sugar cravings are quite strong.
Yes, very strong at that peak.
Okay. Along with this, tell me, how regular are your periods?
No, they are not at all regular. They are very irregular period cycle.
Right.
And it's been since I'm in my teens.
So I know there are multiple things that you're facing at the moment. Have you ever been diagnosed with PCOD or PCOS?
Aren't they the same thing? I don't know.
They are not the same thing. So when we talk about PCOD, it is Polycystic Ovarian Disease. And when we talk about PCOS, it is Polycystic Ovarian Syndrome, which is more complex than PCOD. In PCOD, what happens every month when you have your periods, your ovaries, they release partially mature eggs or little immature eggs. Because of that, they eventually form cysts. But in PCOS, it is more of an endocrine and hormonal issues because it has multiple additional problems with it. It affects your metabolism, it affects your hair fall, it causes infertility, it also causes a lot of weight gain and sugar cravings. So, and also eventually it leads to blood sugar and insulin intolerances, which can also result into type 2 diabetes. So a lot of times people have PCOS, but there are no cysts which are detected in their ultrasonogram.
Back then I used to think it is because of just I'm having too much stress or because of the exam preparation. So what could be the reason for this?
So the main reasons for PCOD and PCOS is your lifestyle, your stress, your diet, and also what runs in your genetics. So genetics is one of the most important reasons for PCOD, but the cases that I have been seeing with my patients, they're mostly lifestyle induced. So the girls from their early age and also their teenage, they're not eating healthy. They're eating a lot of junk, they're eating fried food, they're eating a lot of sugar, there's too much exposure, there's lack of exercise, and also the diet that they're eating is not clean and healthy, it's lacking in protein. And all these things result into PCOD or PCOS. It results in period cycle irregularities, sleep issues. Again, sleep issues is going to cause stress on the body. So it is all interconnected, and a bad lifestyle will result into PCOD. And again, obesity is one of the main contributing factors also. So PCOD can make you fat, and if you're fat, it can result in PCOD. So both are interconnected.
I didn't think much of it before, but once this acne, weight gain, hair fall started, I started getting worried about it.
So also another alarming thing I see with the girls is they don't visit a proper expert, and then they will go on very bad crash diet just to look good and just to lose the weight, and that aggravates and increases PCOD even more, and it just makes everything worse. And they eventually understand all of this at a much later and complex stage where then they have to go on pills. They have to go on, OC pills and hormone balancing pills, and then reverse all of this, which is a way more complex stage. If you understand and reach out for help at the right stage, you can actually reverse PCOD. I can actually promise you that PCOD, when it's lifestyle induced, it is completely reversible. You don't have to be on pills and medicines your entire life.
Yeah, is it common that people actually think that stress is the major reason for being in a PCOD condition?
Yes. So stress honestly will start everything. Stress will affect your sleep. Stress will affect your eating habits. Stress will affect your workout routines. Even showing up for workouts is also important. And stress can affect that. And also stress does something to your body, which is called as metabolic issues. So it will activate your sympathetic system, and again your entire cortisol and stress hormones will be released. Even that causes weight gain.
हाँ, मैं बहुत ज़्यादा irritability feel करती हूँ, and this unwanted hairs on chin and upper lips. It's very embarrassing, you know.
Right. So this mainly happens because of your estrogen and progesterone imbalance. That is why you have unwanted body hair. When this imbalance is also happening, you're eating a lot of sugar because you crave sugar. So that also starts affecting your gut, and eventually you get a lot of acne on the face. You get acne on your neck also, on your chin also, on your back also. So that is also one of the alarming signs of these fluctuations. Anything else that you're facing?
No, just the mood swings. I'm facing too much mood swings. Like one time in the morning I'm happy, in the afternoon I'm sad, and then again in the evening I feel like I have to cry.
Right. So mood swings are also happening because of two main reasons. One is, again, your hormones are going up and down very fast, and they are fluctuating not normally. Ideally, your hormones have to fluctuate according to your period cycle. So you have menstrual phase, you have ovulation phase, you have luteal phase, and you have follicular phase. So according to all these phases, the hormones have their own time when they have to go up and when they have to go down. But with PCOD, they're going up and down any random time, and this is why you're facing. The other reason why you face this is also because your blood sugar goes up and it drops very fast. So that also starts affecting your mood and your eating patterns.
Yes.
So these two things are mainly responsible for your mood swing.
And doctor, recently, see, I've noticed this dark velvety patches around my neck and underarms. This is the reason behind PCOD?
So this is one of the biggest causes for PCOD, which happens in a lot of blood sugar imbalance. So when your insulin and your blood sugar is not in place, and when your blood sugar is spiking way too much, which is also resulting in also weight gain, and all of that causes these dark, black and velvety patches deposition on your skin folds. So for that, you also have to keep your sugar in check, and along with that, we have to address the PCOD aspect also, because the hormonal imbalance is also one of the cause for this.
Okay, so अब मेरे साथ क्या हुआ है ये कैसे figure out करेंगे?
So now I know your symptoms. I mostly feel it is PCOS, that is the syndrome. I am going to recommend you to go to a gynecologist and get your sonography done, see whether you have cysts or not. And other thing is also, I'm going to give you a range of blood tests to do, which is going to have your hormone profile, your cortisol, your CRP, your cholesterol, everything in it, also your blood sugar levels and HbA1c. And when I see your blood work, I will know exactly what is happening with your blood sugar balance and with your cholesterol, and also with your hormone profile. And once I get your gynac report, I will know whether you have the cyst or not, and then we can categorize this into one of them and take the right treatment.
Any particular line of treatment for that, or only medications are going to work?
Medications are not very important. Your other lifestyle habits and your eating habits are way more important. If we feel it's a very complex and advanced stage of PCOD, I will tell you if you need to take medication, but 90% of the cases you don't need the medication.
So I have started eating healthier recently, and I have cut out the junk food from my diet, but I don't know how to start and what to start.
So see, now you know what is happening to you, and now you also know that this is a PCOD or a PCOS. So the basic line of treatment is going to be the same for both of them. That is taking care of your blood sugar levels. So no eating processed sugar, white sugar, sweets which have a lot of sugar in it. For example, cakes, donuts, pastries, no processed sugar. You have to cut down sugar very smartly. I know when you're doing that, you will crave sugar and you will have your sugar cravings. So you start managing your sugar craving naturally. For example, when you crave something really sweet, you have to reach out to a date or a fruit or dark chocolate. So that will naturally help you get rid of your sugar cravings eventually. And when your body is used to reaching out for a natural form of sugar, it will stop even craving for these processed sweets. So your sugars cravings will also go down when you deal with it in a better way and in a natural way. There's another trick I'm going to tell you if you want to cut down your sugar craving. Whenever you crave something sweet, have something bitter. For example, black coffee or a very dark chocolate. So the bitter taste on your tongue, it will cut down that sweet craving. It will, contradict that. And that actually helps you get rid of that craving at that particular moment. So that is something I want you to try and tell me. Now, the second thing that you have to do is cut down your carbs, especially the simple carbs. For example, your bakery products. So no processed food, no packaged foods, no chips, no potato fries or any kind of fried food. You have to cut this down because this is also causing a lot of blood sugar imbalance and hormonal issues in your body, and your blood sugar is not being able to stay stable.
Do I have to completely cut the carbs from my diet?
No, you don't have to cut down carbs completely. You need good quality carbs for the right hormonal functioning. So carbs like millet rotis, grains which are nicely soaked and well cooked. Also good lentils. These are all complex carbs, and lentils which are sprouted as well. So they have good protein also, and they have a good complex carbohydrate. So what complex carbohydrates do is they don't spike up your blood sugar, because any simple carb is going to give your blood sugar spike like that and a drop like that. That is what you don't want. You want your blood sugar level to be stable the whole day in your body.
So how can I keep my blood sugar level stable?
Yeah. So you can keep your blood sugar level stable by having something rich in protein and fiber in your every single meal. Along with that, you can have some good fats. For example, if you're having breakfast, you can have some yogurt, put some fruits in it. Along with that, put some nuts and seeds. For example, pumpkin seeds, sunflower seeds, almonds, walnuts. So you get protein from yogurt. You get good carbs and fiber from fruits. And the nuts and seeds will give you good fat. So this is the right food combination for PCOD. For example, if you're having lunch, you can have a roti, one green leafy vegetable, one, sprouted dal and usar. So you have your fiber. For fat, you can use some ghee, some olive oil. That will be a good fat. So meal combination is very important in PCOD.
Is there something do I have to cut from my diet completely for better hormonal function?
Yes, especially if you have PCOD and you're trying to reverse it naturally, you have to cut down dairy, that is milk and milk products, and gluten. When I talk about getting completely rid of dairy, that is except your buttermilk, yogurt, that is dahi, and ghee. So ghee has no lactose in it, no lactase in it, and it is completely clarified. So ghee is technically not dairy when it's the final product is there. And dahi, that is yogurt, and buttermilk are fermented. So they still have good bacteria in it. But the reason for cutting down dairy is when you have milk and milk product, for example, milk, whole milk, or even low-fat milk, paneer, cheese, all these things have the hormone from the cow or the buffalo that you're having. So it has the estrogen from these animals, and this estrogen comes in your body, and then your body also gets confused. It also addresses that estrogen as a foreign and artificial estrogen, and it causes completely hormonal mess in your body. Other than that, dairy also causes a lot of inflammation in your body. Same goes with gluten. When you're having gluten, that is genu, maida, white flour, all these things have gluten in it. And gluten is going to cause a lot of gut inflammation. That is, it is going to stick to your gut linings. And when it sticks to your gut linings, it causes leaky gut. It causes gut inflammation. And all this leaky gut is going to, again, these toxins and bad bacteria are going to go in your bloodstream from your gut lining, and this gets rotated through your whole body and causes extra inflammation, which is going to aggravate your PCOD. When you get rid of PCOD, you can always introduce these foods slowly in your diet. You can always have a way around eating these things, but not when you're trying to reverse a disease.
Then will I get deficient in calcium or any other nutrient by cutting off dairy completely?
So, this is the biggest misconception about calcium and dairy. And a lot of people don't know this, but the calcium that you drink and that you get from milk, it basically doesn't get absorbed in your body. So the calcium that your body can absorb and that your bones can use, it's something that you get from green leafy vegetables. You get that from eggs. You get that from, even the plant-based milks like almond milk. You get good amount of calcium in that. So you can get a lot of sources of natural calcium. And you don't need dairy for that, because the calcium that you're anyway getting from dairy, your body is not able to use it. So your body is in fact leaching out more calcium when you have so much dairy.
I've also heard that I have to take a lot of supplements to get over this PCOD. So is this true?
So supplement, it also depends. Like for example, I meet people on a regular basis who have two thoughts about supplements. So people think supplements are medicines. Supplements are not medicine. Supplements are food in a capsule. They are vitamins and minerals, or whether it's protein, that is just concentrated form of it. And you have to know what is the right supplement for you. So don't take any supplements blindly. If you're taking supplements blindly, it's going to cause some mess in your body and it's going to, put you in some other health issue. You have to take supplements according to your blood reports, by an expert, by a doctor, because these days it's very difficult to get high quality food, and because of that your body goes in a lot of deficiencies. When your body goes in deficiencies, it has to compensate for it, and then that results in some or the other health issue. So take the right supplements, but take the supplements with an expert's advice.
So filhal to I'm not planning for kids, but in future I may plan for kids. So what are the precautions or tips you would give me for that?
If you're planning for kids and you have PCOD, regular ultrasound is a must. You have to do that every 6 months. Other than that, every 6 months you also have to do your blood work. So you need to check your entire blood profile and also your hormonal profile. Along with that, you have to also be at your right weight for your BMI and for your body type. And you also have to be on the right supplement, especially when you're planning a pregnancy. As soon as you get pregnant, you need a lot of iron and you need a lot of folic acid, because as soon as you conceive, the brain and the spinal cord development starts very fast. For that, you need folic acid, you need iron. So I always suggest that when you plan your pregnancy 3 to 4 months before, take the right supplements, keep your body ready, keep your vitamin ready, keep all your stores full so that your body and your baby can have it, whatever it needs.
Yeah, but I can conceive naturally with PCOD.
Of course. I have many examples who have reversed their PCOD and also conceived naturally. You don't always have to go for IVF.
Okay, thank you. There's so much information regarding PCOS and PCOD on internet. It's really confusing. I feel relieved after talking to you. I was unnecessarily depriving myself.
Super. I'm glad. But now don't be very impatient. Don't think that you just have to give it a month and it will all be resolved. You should always give anywhere between 4 months to 6 months to reverse a complex health issue like this. And you really have to be little disciplined. But when you reverse it and when all your parameters come down to normal, life becomes very easy.
Thank you.